In many states, different professions can study a very short amount of time, about 100 hours, place needles in you and call it acupuncture. So you must make sure that the practitioner that you see is a doctor of Oriental medicine or a licensed acupuncturist. Chinese needles are different from Western needles in several aspects. You know how when you go to the doctor's office and you get a shot, it really hurts? Well, that's because those needles are about this big. And they're hollow. And at the end, at the tip, they're cut on a slant. It's called a bevel. Chinese needles, on the other hand, are solid. They're about as thick as one of the hairs on your head, and at the tip, they're rounded, sort of like a ballpoint pen. So when I place them in your body, actually two things don't occur. You don't bleed, and it doesn't hurt. Now, you might feel the needle break the skin, but it's certainly nothing compared to a hypodermic syringe. So now I'm going to place a couple of needles in Tracy for general purpose. This is a treatment that it's a general purpose all-around treatment designed to kind of harmonize her chi and to strengthen her chi. The first needle I'm going to place, however, is not part of the general prescription. It is a point right between the eyes that I usually put into new patients because it's a wonderfully calming, centering point. Typically patients who get this point request it over and over again. Now, when I put the needles in, I'm looking for a feeling of heaviness or dullness or a throbbing or an aching. The first time I put the needles in, it's not uncommon for patients not to experience that, but typically after 2 or 3 treatments, they feel it. All right, this is a 40 gauge needle, 1/2 inch. This is the smallest needle that I use. These are the needles that we place in the face and in very sensitive areas of the body. So I'm going to place this in our model's forehead. There. Okay. Now I'm going to place some needles in her legs. Okay, now I'm going to place needles in a point along the spleen channel and a point on the stomach channel. So what I'm doing is I'm finding the point. The point's in generally a specific area, and then I can feel the point. So I locate the point and place it. That's it. How do you feel? Okay. I'm going to place the next needle in the opposite foot, same point. There. Okay. And now for the points on the stomach channel.